Hi, this is Ben. Let's briefly discuss where hormones act on the kidney. Remember, some hormones are secreted from other parts of the body, but act on the kidney, such as atrial natriuretic peptide, or ANP. Why would other parts of the body need to communicate with the kidney? Two main reasons would be to regulate blood pressure and solute concentrations, since these are two things the kidney has a lot of control over. Atrial natriuretic peptide, which is secreted by the heart in response to increased atrial pressure, causes increased GFR by dilating the afferent arteriole without a compensatory increase in sodium reabsorption. This leads to increased sodium and water loss, bringing the blood volume back down. To remember the effects of parathyroid hormone, just remember that this hormone's job is to increase the serum calcium and decrease serum phosphate. PTH acts in the distal and proximal convoluted tubules, as well as the gut. Some people like to remember PTH by calling it the phosphate trashing hormone, and even though that's not what it stands for, it is a good representation of how that hormone acts in the circulation. Can you recall which hormone opposes PTH? Correct, calcitonin. And where is calcitonin secreted from? Correct, the parafollicular C cells of the thyroid, as this hormone acts to decrease serum calcium levels. What endocrine tumor produces calcitonin as a marker? The answer? Medullary thyroid carcinoma. We've covered the renin-angiotensin-aldosterone system previously, but let's quickly review the two main functions of angiotensin II. Can you remember what they are? Awesome. Angiotensin II will constrict the efferent arteriole and increase sodium reabsorption in the proximal and distal nephron. Aldosterone will increase sodium reabsorption in the collecting tubule. Quick question, how does aldosterone function linked to ADH secretion? Aldosterone increases sodium reabsorption, and this will increase plasma osmolality, which will stimulate the secretion of ADH. ADH will then stimulate increased water reabsorption to restore plasma osmolality. As you can see, the kidney is more than just a filter for the blood. This is why renal pathology can be so devastating, and why damage to the kidneys is a serious cause for concern in the hospital. Thanks for listening.